We're getting more news about the cough syrup tragedy. Now the Central Drug Standard Control Organization, Cdsco, will write to Tamil Nadu FDA, the Food and Drug Administration, to take strict action against Coldrif syrup manufacturer under most serious offences. This is as per the official sources. The drug control body is cracking down on Coldrif cough syrup. The drug control body Cdsco will write to the Tamil Nadu FDA. Cdsco recommends action against Coldrif. These are serious offences, said the action against manufacturer must come in. Cdsco has just come in and said this. For more on that, we have Shreya Chatterjee joining us. Shreya, now we see that the Cdsco is saying that strict action will be taken against the drug manufacturer and is also going to write to the Tamil Nadu FDA. Is there some sort of accountability when we look at this? Are they saying that there was some lapse in quality checks when we look at the cough syrups?
Well, clearly there were, because when the batch was picked up from their Tamil Nadu manufacturing unit, they did actually find high levels of some chemicals that were found to be contaminated in those batches, including chemicals like diethylene glycol. So clearly, that is the reason why we see this crackdown sped up even more faster and bigger. Right now, with the Cdsco stepping in, which is the Central Drug Standard Control Organization, asking the Tamil Nadu FDA to clearly ensure that strict action against Coldrif. We will see in a short time that the drug manufacturer will be pulled up for the entire incident, because clearly, remember, there has been a huge number of deaths also in this particular incident, and that's the reason we will definitely be seeing Coldrif being cracked down, with the doctors and the middlemen who were also responsible for the access of this drug in the market coming under the radar. It is but obvious that the manufacturer will also be pulled up for this incident.
Right. So now we're seeing that after deaths in Rajasthan, Madhya Pradesh, Kerala, we're seeing strict action will be taken by Cdsco, who's recommended that strict action will be taken against the Coldrif drug. This cough syrup has already claimed many lives. In the morning, we saw Dr. Praveen Soni in Madhya Pradesh's Chhindwara was arrested, and now we see the centre stepping in. They are going to address the states and the unions through a video conference. And now the Cdsco has also issued a statement saying they'll take strict action against the FDA and will also write to the Tamil Nadu FDA. There's some serious lapses when we look at the quality checking of these drugs. As also Shreya just mentioned, this drug was found to have a chemical in it, which clearly indicates that there is some serious concern, and questions need to be asked to the drug controller authorities as well as the health inspectors. But we're seeing that a crackdown, a state-wise crackdown, is being witnessed right from Madhya Pradesh to Rajasthan and also in Tamil Nadu. We're also, when we're looking at how these drugs are being prescribed, we see that a lot of doctors are, under the scanner when we're looking at this cough syrup tragedy. For more on this, we have a Dr. Hemant Sharma, who's a pediatrician, joining us live. Dr. Hemant, when we look at this cough syrup tragedy, we're seeing a lot of pediatricians and doctors had prescribed these drugs because of which the lives of children were under the scanner, and we saw so many lives being lost, right from 6-year-old in Jaipur to even a 60-year-old who was affected after taking this cough syrup. What is the kind of measures that the doctors are right now taking when they're looking at prescribing this syrup?
Actually, it's a sad story that so many kids have died, and there can be many reasons, and sometimes it could be associated with the cough syrup only, and sometimes it could be some other thing also, some like overdose, because a lot of flu is going on. It could be primary pathology, primary disease that might have caused these babies to deteriorate. So I don't know what's the ingredient in the cough syrup. Doctors usually prescribe it, so we don't know what it really contains. And as far as the Indian government have done the inquiry, they have found that no toxin has been found. So it could be, because the influenza virus is going on, it's quite serious. It's like a COVID pandemic, and influenza pandemic is going on. It could be related to that also. Usually now doctors, we are not prescribing that much of cough syrups, and IAP advisory body has said that not to give cough syrup unnecessarily. We're trying to restrict the use of cough syrup in small children. Instead, we're doing home remedies like honey and some water with it.
Right. But after these deaths we witnessed these deaths statewide, there's also sort of a scare when we look at, taking these medicines. What would be your advice as a pediatrician to those, sitting at home and watching this when it comes to cough syrup? How should they be using it, and what are some things that they should, take note of?
The Indian Academy of Pediatrics has clear guidelines that cough syrup do not improve cough, first of all. So unnecessary use of cough syrup or overuse of cough syrup is just harming the baby more. Instead, what we can do, we can use home remedies, especially those less than 2 years and preferably less than 5 years should not be given cough syrup. And like when somebody is taking it, they should, look into it. It is really required. Can we do without cough syrup? Just a little irritation, warrant a use of cough syrup. Cannot we do, it has been found out that cough syrup are as good as placebo, and honey moderately improves cough, distress due to cough. So can we go with the honey or all those small things and the home remedies?
Right. And in the morning we saw Dr. Praveen Soni was arrested in Chhindwara. He had prescribed this cough syrup to most of these kids who have now died, and these are very young children. So when you, since you are a pediatrician yourself, what kind of recommendations would you also give to the doctors who would now be, looking at this cough syrup, and we see that large amount of batches are especially present in Rajasthan and Madhya Pradesh?
The batches are not because, if they are spoiled batches, they are not because of mistake of doctor. He will just give any cough syrup that is supplied to him. So, but still, most of the pediatricians, they know it and they should be doing it. We do not unnecessarily prescribe for cough syrup. Restrict the use of cough syrup as much as possible. In Western world, we do not give cough syrup to any child who is less than 5 years. So I think so if we go ahead and stick with this policy, such incidents will be quite less. Similar incidents happened in Africa a few years back also. Since then, I've stopped using cough syrup for less than 5 years myself.
Right. We have seen these kind of tragedies even in the Western world and in Africa, in Gambia recently. Well, thank you so much for joining in, Dr. Hemant. This was really insightful.